Mindfulness and Suicide Prevention, presented by Alex Powell at Eastern Kentucky University. This presentation will be broken down into several parts to most effectively relate practice of mindfulness to suicide prevention. First, the statistics surrounding suicide in America will be covered at some length. Next up will be the section detailing the definition of mindfulness in a scientific setting to give an idea of what it is. Following that, the benefits of mindfulness as a whole will be explored in several aspects that may or may not apply to suicide prevention. The next part will look at how taking a mindful approach can help someone recover from suicidal ideation. This slide will also refer to how mindfulness in other people can help those who are suicidal. The final slide will sum up the most important information. Suicide runs rampant in our society, and the statistics around it paint some pretty vivid pictures. Suicide takes the lives of nearly 40,000 Americans every year. In comparison, there are twice as many deaths due to suicide than HIV or AIDS. The unfortunate commonality of suicide is apparent, as between 1952 and 1995, suicide in young adults nearly tripled. Over half of all suicides occur in adult men ages 25 to 65. Over half of all suicides are completed with the use of a firearm. For young people, ages 15 to 24 years, suicide is the second leading cause of death. 1 in 65,000 children ages 10 to 14 dies by suicide each year. Suicide is the 10th leading cause of death in the United States. In comparison, homicide is the 16th. It is estimated that there are at least 4.5 million survivors in this country. However, 80% of people that seek treatment for depression are treated successfully, meaning that 15% of those who are clinically depressed actually die by suicide. Many people who attempt suicide never seek professional care. It is up to the people who are not suicidal to help those who are and be able to recognize when these people need help. And one way to obtain that end is through mindfulness. Mindfulness is rooted in the Buddhist culture as a practice to view the world in a different way. Mindfulness has been defined a number of ways, including the scientific operational definition, which defines it as a focus of awareness and orientation to being open. There is a separation between the Buddhist conception of mindfulness and the scientific conception of mindfulness. But for this presentation, the focus will be on the scientific conception. Mindfulness helps a person pay attention to the now and to keep that attention as to not be distracted by other stimuli, thoughts, or feelings. Through mindfulness, a person does not learn to block out their thoughts, but rather to accept and understand all thoughts an individual might have. Mindfulness has many other components to it as well, one of which is the idea of compassion. Both compassion for others and self-compassion are very important for identifying and helping those who may have suicidal ideation. Mindfulness can benefit a person in many ways, and if practiced with persistence, can help a person overcome any problem or endeavor. Mindfulness can also be utilized to help a person relax and remove stress by focusing on those thoughts through an alternate perspective and state of mind. Self-compassion can help any person see their own worth and understand things from an alternate view outside of their normal view. Through mindfulness, a person can see past all biases and identify a problem from an indifferent position. Mindfulness can help a person see past the selfish needs of an individual in life and see the necessity to help others is more important than each individual person's wants. Mindfulness can be specifically applied to help aid suicidal individuals in a number of ways. One of the main ideas of mindfulness is to focus one's attention on a thought and to identify and deal with it through a different state of mind. The suicidal individual may obsess over thoughts of ending their own life, but through mindfulness exposure and training, they can deal with these thoughts in a less detrimental manner. Mindfulness also has a basic idea of self-worth, so that an individual who is suicidal may see that their life is worth living. Through mindfulness, each individual, and especially suicidal people, would be able to see their worth within themselves. Oftentimes, the viewpoint of a suicidal person is narrow. As such, it would be highly effective for a suicidal person to broaden their viewpoint through mindfulness training. Furthermore, it sometimes happens that a suicidal person cannot see their own worth because they think the world is better without them. However, through mindfulness, a person can perceive the world around them and feel compassion towards others in that world and want to help them. If they realize how much they can help others, then suicidal thoughts may disappear completely. One final note is that it is up to the therapist to be mindful of using mindfulness as a treatment method, and so it must first start with the therapist's belief in mindfulness training to begin helping their patients through it. Several studies were performed which tested the usefulness of mindfulness in aiding people who were suicidal. One approach to treatment utilizing mindfulness involved breaking down the components of mindfulness into the what and the how. The what skills were broken down into 3 parts: observe, describe, and participate. The observation involved perceiving what was going on in the external physical world of the patient, as well as what was going on in the internal world of the patient, such as emotions and thoughts. Describing means literally articulating what a patient is experiencing to the best of their ability. Participating was the final what skill, and it involves living purely and becoming part of the present moment. The idea is to focus on the moment so that a person is completely engrossed by the task at hand and is fully experiencing it. The 3 how skills include practicing non-judgmentally, practicing one mindfulness, and focusing on what works. Practicing non-judgmentally involves letting go of all labels of good or bad, but simply focusing on the thoughts or feelings as they come up for what they are. Practicing one mindfulness means to focus on one task at a time and to bring a wandering mind back to the task at hand gently if need be. The 3rd how skill is to focus on what works so that in doing so you aren't thinking about getting different or better results, but understanding that what is already being done is beneficial and is helping. A second study looked at the use of mindfulness-based cognitive therapy, or MBCT, as it applied to suicidal recovery. Specifically, one article looked at the use of MBCT as it applied to self-discrepancy theory. Self-discrepancy theory states that an individual will tend to form a connection between their current self-view and their self-goals in the case of major depressive disorder and suicidal individuals. Self-discrepancy can lead to a belief that an individual is falling short of their goals. The results of the study found that patients exposed to MBCT were far less likely to have negative viewed self-discrepancies compared to patients who were given no treatment. The difference that the study found was that MBCT individuals gave less attention to self-discrepancy, and in fact often exhibited positive self-views instead. In conclusion, it is important to note that suicide can be prevented. Mindfulness is a legitimate treatment that can help an individual overcome suicidal thoughts. With mental health issues more common in America today, it is important to get individuals the best possible treatment. Since most people who commit suicide do not actually seek professional help, it is up to everyone else to be the first responders. Through mindfulness, we can recognize and show compassion towards suicidal individuals and pass that mindfulness on so that the trend can continue.